This is Talk Business and Politics with Roby Brock.
Well, this week, Governor Asa Hutchinson laid out his latest vision for health care reform to state lawmakers and business policy leaders in a 7-point plan. He said they are starting points for conversation. So we invited him on the show for a conversation. Governor Hutchinson, welcome.
Glad to be with you.
It's been a busy week. You've been a busy beaver this week. So thank you for making time for us.
I'm delighted to. Always good to talk about the politics of the week, health care, and many other topics.
Let's begin with your presentation. I'm going to boil down to its simplest form my interpretation of what you said to legislators on Wednesday. Keep the Medicaid expansion and the money with it if the feds will give us all the waivers that we want. Is that an accurate description?
That's a very good summary of it. I would add not just the waivers I requested, but more flexibility overall, because we have to create savings as one of the elements in our Medicaid program in order to cover the expanded population and the state's share of that without draining general revenue. So the flexibility is a key part of it. And yes, with that, it's the right thing to do for Arkansas in terms of health care, in terms of our budget, in terms of our economy, to make sure that we can have that flexibility.
What if the feds don't go along with everything? What if there's a request for, let's say, 5 or 6 different waivers or this global waiver per se, and you only get pieces or parts of it? Is it still, do you see a vision for it being doable still, or do you think it torpedoes every chance if you can't get everything that needs to happen?
Well, let me pause and just say this is going to be really a legislative solution. It was important for me as governor to lay out 7 elements that I want them to consider and start the conversation. They may say, well, we don't want this element, or we want to adjust this. So there's going to be that conversation. And then we're going to go and we're going to seek those waivers from Washington. I'm very optimistic. There's some that push the envelope. We want more flexibility, a global waiver. You know, and that's happened in, I believe it's Rhode Island, you know, has tried that, has done that rather successfully. Utah has put in the work referral requirements. Indiana has had the premium assistance provisions. And so we would probably be the first ones to have all of these combined together. But that's what's necessary in order to give us the flexibility and to have the work incentives that we want. So that's improving, that's moving us in the right direction. But I think it's doable. And it's going to be, it could be what I'm concerned about toward the very end of the administration before we get the approvals that we need or until we know the outcome.
Are you talking about a 4-year term or an 8-year term?
Oh, I'm talking I'm talking about the end of President Obama's term.
I got you. Okay. All right.
Not my term.
Federal level there. All right. So walk me through some of the math that you struggled with as you put all this together. You kind of laid out to the legislature, you can kill this thing altogether. The state could absorb all this altogether, or we could do this hybrid of state federal that we're doing now, which is what you advocated as your what you called only one option. We've got to do this Medicaid expansion. The numbers from the consultant's report were $438 million in savings between 2017, 2021. You've got a different set of numbers, but close.
Right, they're close, and you know, whichever numbers you take, the private option is a positive net flow for the state budget until 2020 in that time frame. And when you talk about the consultant's report, 430-some million positive benefit for the private option, it's really from the Medicaid expansion and the federal dollars that come in. But in 2020-21 time frame, it turns red and it starts mounting up to about 50 million a year. So I look at 50 to 60 million a year that we're going to have an accounts payable for down the road. And it's the right thing to do to plan for that now. And the legislators expect that. But I've offered a decision tree. We don't want to leave 220,000 on health care right now behind. We want to make sure it's affordable for us. We have work incentives, we have flexibility to do that. We can only do that really in partnership and to have the flexibility we need from the federal government.
There was a lot of talk this week too about managed care. It was a little bit of a side story to the private option here. In your mind, is managed care inevitable for some of these programs?
No. It's inevitable that we need to consider cost savings in the program, and this is a very important element that I offered to them, that we're going to have $50 to $60 million a year in savings. Where does that come from? It can come from a managed care approach. It can come from expansion of the payment improvement initiative. It could come from reducing fee-for-service. It could come from other types of efficiencies. And you don't have to say yes to all of those, but you can't say no to every one of those. You have to say yes to something. And so the legislature has to help me to find out the right direction in terms of savings. Those are the options on the table, and managed care should be one of those that talked about.
All right, I'm going to switch gears on you. We're going to talk about something coming up this next week, the Restore Hope Job Summit that you have pushed for. What can we expect to occur, and do you have some specific goals that you want to see achieved from these couple of days that people will be together?
There's 3 goals. One is to thank the faith-based church, synagogues, nonprofit community for what they've done already in terms of social services and helping those coming out of prison and helping those that are needing foster care. Secondly, I want to listen to them very carefully to see what obstacles are there in dealing with the state government. There's some things we can do better to make sure our doors are open, that we can make the system work better. Paul Vincent, that wrote the child welfare report for us, said there's things that we can do better and break down some of those barriers. The third thing is to inspire them to do more and to ask them to do more, to encourage their congregations, their faith-based groups, and to do more in terms of foster care. We've got to take care of these children. We've got to protect them. We need their help to do that.
Are you worried from the criticism that has come that you're asking faith-based organizations to do too much, that there's too much together in terms of working with public taxpayer dollars?
I'm not worried about it because we narrowly focus this on 2 issues. We're not asking them to partner with us on everything. They do a lot in caring for the hungry and trying to solve that problem in our state. But these are 2 specific areas, foster care and second chance for ex-offenders. 2 specific areas we're asking them to look to carry out their ministry. And you think about it, we've shifted in healthcare, for example. There's fewer medical clinicals out there, so we eliminated some charity care because the state took on more. This is a good example. Let's don't have the state take on more. Let's ask our churches to come and help us.
All right, I'm getting the wrap-up sign. I'd love to talk with you about another 15 or 20 minutes here, but Governor Asa Hutchinson, thank you so much. Appreciate you.
Thank you, Roby.